Morning, everybody. It's Dr. Karen. We are live for the Language Therapy Insiders Club live Q&A. So on these calls, I'm going to go through member questions relating to language therapy and talk about some answers so that we can work through those clinical cases. So on this call, I'm going to go through and look at our thread in this discussion group and see what questions have been coming up in the group over the past month since I've done the last Q&A. And what I'm going to do is dive deeper into some questions from members that have come up so that we can really talk through some of these cases relating to things like language, literacy, and just overall productivity when you are an SLP treating school-age language disorders. So you will see me looking up like this because what I've got is another window open on my other monitor up here where I've also got the thread so that I can see what questions have come up as I answer them. So with that being said, we're going to go ahead and get started today. So we've got a couple questions from members, one about data collection. We've got one about applying the problem solving process that we learn in Language Therapy Advanced to figuring out how vocabulary ties into language and literacy. We've also got a question about a student with just a very complex case history, really more in the speech sound disorders realm, but the question is more about when should I make an outside referral and how do I handle that? And then we'll also touch on goals for Tier 2 vocabulary because that question came up again and it comes up quite a bit in this group. So with that being said, let's get started with the first question. So this question is, and I'm just going to read it out loud. It's about data collection. So the question is, our school uses IEP Direct, and there is a schedule as to when you will be addressing the progress toward the goal that has to be put into the goal information, such as every 2 weeks, monthly, weekly, etc. So our special ed director wants the schedules to reflect weekly or every 2 weeks. So my question is, if I see a child 2 times a week with 4 other children, sometimes with different goals, I feel like I'm taking data more than the time I would like to spend actually teaching the skill. For example, I had a writing compound sentence goal using coordinating conjunctions to be measured for progress monthly, thinking I would teach the skill 2 times per week and measure it the 4th week, but she wants me to take data on them weekly or twice a week. How do you handle all of that and find adequate time to teach each skill? So first of all, this sounds like a case where the person who is making the guidelines has no idea what is actually going on in therapy and really does not understand how language works. I've said before that I get very frustrated with some of the guidelines about data collection and really just how we have to write goals because they're trying to make something so objective. And of course, we need to make things objective because if we have complete subjectivity, then there's no way to tell if things are working and things like that. And we need to stay accountable. And obviously the laws are there for a reason. And there were good intentions behind the people who made them. That being said, people want to fit language in this neat little box, and it just doesn't fit in there because language growth is not linear. That being said, with this specific example, production of complex and compound sentences is actually one of those language skills that does have some linear growth and is kind of a good representation of overall language sophistication. So we have that going for us, but really the bigger question is, how do we make this work? And so number one, if you have the option to take data on goals less often, definitely do it. Within the school that I was in, we had to report on progress in conjunction with the grading period. So I would always put on the little IEP system, I would always put grading period or quarterly because they did quarterly grading periods. Now my colleague who had the preschoolers, they only sent report cards home twice a year. So she technically only had to report on progress twice a year, but because she felt, that's the minimum requirement, but I want to be better than the minimum requirement, she always took data more often than that. That was just the grading period was just when she was actually sending it home to parents. So really that grading period for us was the minimum amount. So at the very minimum, you want to be taking data on goals, all the goals quarterly. Now you might have a couple goals here and there where you might put something like not making progress or not addressed yet, because you might be planning on working on it in a certain sequence or working on it later in the year. I think that's okay as long as you're not doing it constantly. If you're always doing it and you're doing it all year, or you do it all year one year and then you write the goal again and you do it again the next year, then obviously you want to reconsider that goal. But for just 1 or 2 quarters while you work on some prerequisite skills, putting not addressed yet is totally fine. Now let's get back to the question of how do we appease administrators who want us to be abiding by these guidelines that just aren't realistic. So for example, if you were if we're taking it from the realm of special ed teachers, I know that I had a lot of times administrators who were managing the whole special ed department. They would say, all right, everybody, I want you to do it this way. And it would be feasible and it would make sense for a lot of the special ed teachers, but it would not make sense for the speech pathologists. For example, I had an administrator that was like, you should have weekly phone calls with all of your parents. And that was feasible for the special ed teacher who had 10 kids. It was not feasible for me who had 60 kids. So, and I asked him about it and he's like, yeah, obviously for you speech pathologists, you should get on a schedule, but it doesn't need to be that often. And he didn't think of it because, administrators have a lot going on and there's no possible way they can fully understand everybody's role, because it's not necessarily their job to understand the intricacies of every single role. It's just not possible. So that's why this kind of thing happens, because if you think about it, it would be more feasible for a special ed teacher to take data on a goal weekly or every other week. I know that while I was taking data on my goals, at the very minimum quarterly, usually I would do it more than that, but there were certain goals that I would wait till quarterly because I felt like I needed to wait until I'd worked on the skill. But special ed teachers that I worked with, they were taking data on goals more often than I was, because they had an entire 40-minute period plus time that they were in co-teaching, and I just had 30 to 40 minutes a week. So it just didn't make sense for me to be taking data that often. So in this case, I always recommend just asking about it, because there were certain times that I would say, hey, wait a minute, what about us? And then the administrator would be like, oh yeah, you're right, that doesn't make sense. So sometimes if you present that to them and just kind of explain where you're coming from with your logic, there is a chance that they might say that you can do things a little bit differently, but then there's always the chance that they just won't get it and they'll say, do it this way. So with this particular discussion in this thread, and I'm actually going to go ahead and just kind of scroll through some of these comments. So my recommendation for this person was, at the very minimum, do a really detailed data collection every 6 to 8 weeks for all of your goals. But then for your weekly or every other week, just do something. Take data on something, document something. You don't have to do the complete evaluation, but document something just to stay within the requirements of what this administrator is asking you. So that's how I'd recommend doing it. Always see if it's always kind of a negotiation with data collection, because you want to strike that balance between taking good data and really the things that you want to be thinking of are, can I make good clinical decisions and am I legally compliant? So you want to strike the balance between doing those things, but then also not doing it so often that it's taking away from your therapy, because first and foremost, we're there to do good therapy. And I mean, if you thought about it, and yes, legal requirements and things like that, would you want to be a therapist who's really good at data collection, or would you want to be a therapist who's really good at therapy and makes a difference in your students' lives, but maybe doesn't necessarily have a perfect way to document it? I'd probably take the second one. So don't lose sleep over it. Do as good as you can. And if you do have a requirement like that, where it's like, this is just ridiculous and it's not feasible, write something down, get it good enough, but then do a really good detailed data collection week or something like that every 6 to 8 weeks where you get really good data. So that way you can strike the balance between actually having the information you need to make good decisions, to see what you need to do next in your therapy and kind of get yourself out of the weeds so that you know where your students are and also make sure that you're compliant, but also not take away from what you're actually doing in therapy. So that is how I would handle that. All right, so this next post is very interesting. I am going to, it's pretty long, so I'm going to summarize it. And I will say, preface this by saying that clinically, it is a little bit off topic of what we usually discuss in this group. There are certain things in there that have to do with what we talk about relating to language therapy, because I do mention phonology and its impact on vocabulary acquisition, which does have to do with language, but there are some motor speech issues in here that go beyond the scope of what we typically talk about in this group relating to academic language and vocabulary. But I did go ahead and leave this comment up in the discussion thread because there is a component of just understanding collaboration, leadership, and just procedures. So I think that does relate to what some of the people in this group need. So that's why I left it up. So basically, there is a student with a very significant medical history. It looks like there's some genetic disorders going on. There's cleft palate, intellectual disability, ADD, ADHD, so restricted lingual mobility. The tongue is tethered, and he does have some other structural issues. It says dental crowing, high palatal arch, hypotonia, open mouth posture, drooling, hypernasality, poor velopharyngeal closure. Phonological processing errors were cluster reduction, voicing assimilation, gliding, substitution. So a lot of things going on. Also was given the diagnosis of a voice disorder and mixed flaccid ataxic dysarthria. So a lot going on here. There's a severe phonological and articulation disorder plus a dysarthria, and he uses 2 to 4 word phrases and typically sounds telegraphic. So obviously we talk a lot about students in this group. We talk a lot about students who are, you know, again, in the classroom the majority of the time learning academic language. Obviously that doesn't fall in the category, but what she does discuss here in the rest of the post is that this particular student, because he has so much going on, she is coming from the angle of being the school therapist here. And obviously with a case like this, if you're given X number of minutes to treat this particular case in the school systems, with all of those different things going on, it's going to be really hard to meet that student's needs. So her question was, where do I go with this? At what point should I continue to be targeting, or at this point, should I continue to be targeting specific phonemes to increase intelligibility? The parent's concern is speech intelligibility, but there was also an AT consult because the student is minimally intelligible, and so they're considering some AAC. So my thoughts were that the first thing that I would be thinking about before you would even figure out what to do clinically is that we need to figure out who is working with this child and how that's going to look, because then once you figure out who all of the team members are, and this could apply for someone relevant or someone who has a language disorder as well, which we do talk about in this group. Whenever you've got a complex case, you want to figure out who's working with this child so that we can figure out who's working on what. Because as SLPs, what we want to do is think about, again, not just what we're doing in therapy, even though that's important, but we also want to think about what is collectively going on with this child. And and do I really need to be the one that's doing everything? Because especially with a case that has as much complexity as this one, you're going to want, obviously, the parents involved and other professionals involved so that you're reinforcing all of these different skills, because there might be a situation where someone might, or the child might need something that falls under the scope of practice of a speech pathologist, or falls under your scope of practice and your capabilities, but you're not necessarily the one addressing it. So there's a couple things that I want to talk about there before I go on to what I recommended for this particular case. But there are a couple, there's a distinction that we want to make here. So there is the scope of practice of what a speech pathologist could address if they had adequate training and skills. And then there is your personal capability, your own personal capabilities, which would be what you are qualified to address. So what we want to understand is that our own personal skill set is not going to include all of the skill sets that could be addressed by a speech pathologist. So whenever you have a student who has a very complex history, you always want to be asking yourself, okay, so yes, this falls under a speech pathologist scope of practice, but does it fall under my own personal scope based on my abilities or based on what I am legally able to provide relating to the specific guidelines of the setting that I am in? So what gets challenging is that when you're working in the schools, a lot of times there are things that you could address based on your skill sets, but that you're not supposed to address because it's not considered to have an adverse impact. Now, in this case, it's a little bit tricky because some people would be like, I remember I had administrators that would say things like, well, that's a medical issue. And I'm like, well, if the kid can't talk, how are they going to participate? You know, if they can't communicate, how are they going to participate in school? That's a pretty big adverse impact. So, you know, I've always kind of thrown my hands up in situations like that. But really what it comes down to is a lot of times just what is really allowed in that educational model, even though it sometimes seems kind of ridiculous. So just keep that in mind. A lot of times you probably are qualified to do more than you think you can, but also be aware of, just because a speech pathologist can address this thing doesn't mean that you can address it. But you could get trained to do that, and then put yourself into a situation or a setting where you are able to do that based on your guidelines. So moving on after making that distinction for you, I wanted to share what I actually shared with this SLP. So basically what I said is that if you are the school SLP, it's sounding like this particular person that asked the question was thinking that the student will need some type of outside evaluation due to all of the complex issues going on here. So if that is the case, if you have a complex case like this, we want to consider a couple things. Now, the challenge is that a lot of times school practitioners get a little bit scared when it comes to making an outside referral, because if the school district says you need to go, tells the parents you need to go have this outside evaluation, technically speaking, if the school is the one making referral, then oftentimes that means that the school district will be responsible for paying for it. If the school mentions that an outside referral or an outside evaluation is a thing that someone could do, and the parent takes it upon themselves to go do it and have their insurance pay for it or something like that, then it's a little bit different. So there are ways to work with that. And really the best way to deal with that, if you really think that it is in a child's best interest in order for them to succeed in school and really just succeed in general, I would see to it that you do what you need to do in order to make sure that that evaluation happens, or at least do all that you can do to make sure it happens. You never can really force a parent to do anything if they really don't want to do something, but if they're open to it, obviously you want to have that discussion. So really, communication is key here. You want to be communicating that to your administrator, because usually, again, there is an administrator who's on that IEP team that is the one who is authorizing the IEP, that is saying, yes, the district has the capabilities to provide these services. We have the resources and the staff and the money and all of those things to be able to provide whatever we're recommending on the IEP. So if you do think an outside evaluation is necessary, you want to make sure that you're keeping your administrators and your IEP team in the loop, because you don't want to make this recommendation to the parent without other people knowing about it, and then have the parent come back to the school and say, oh yeah, the school recommended this, so now you have to pay for this. So you want to be careful about that, but really the key to working through that is just communication. I know that I had a situation where we did do an AT evaluation and decided that the student needed a touchscreen communication device. That was before apps, so we got her a $7,000 communication device. What we did first is just have an open dialogue with, it was me, the school building administrator, and the parent. And the parent first tried to go through their insurance, and the insurance wouldn't pay for it, so then the school district paid for it. So by the time we got to that point, everybody was in the loop. And I did have to, obviously provide some documentation for the higher ups as well, beyond my building administrator. So in a situation like that, I just dealt with it by communicating with everybody. The other thing I wanted to share is that this SLP in this particular case just said, because it's so complex medically, that a lot of times at the meetings, the parents just feel like it's just info overload and they're very overwhelmed. So I recommended that if it is determined that the parents want to go seek an outside evaluation, just giving them some specific steps, kind of walking them through the process, maybe giving them one step at a time, and give them some options rather than just saying like, go do this, because a lot of times if parents are overwhelmed and they have all these endless opportunities and you don't give them specific options, the more that you can narrow that for them and help make the choice easier, the better, especially when they're overwhelmed. Because saying, I need you to have, this evaluation with this type of practitioner, a lot of times the parents might not even know what that is. They might not know if they're looking at the right person. They might go to the wrong place. They might just not do it because they're so overwhelmed. So if you can provide them with names of people and explain the different options that they have, then that will be a better situation where the parents will be more likely to follow through. So really, this is just a matter of good collaboration and communication. So that is all with that question. Then the next one, let me move on up here. Let's see if I've had any other ones as well. We had data collection. Okay. Let me move on to the next one. This one actually came in through an email. This one is about vocabulary skills and prioritizing with some of those early literacy skills. So the question was, I want to work on vocabulary skills with my students, but I feel that the more pressing need is literacy skills. I have a lot of upper elementary kids who are reading at a kindergarten level. I want to target word decoding in the teach a man to fish sense to boost their reading abilities and get them over that early elementary reading hump, in order to allow more independent access to grade level vocabulary and exposure in the reading context. Do I have my priorities straight in that sense? In the sense that she wants to address reading so that the decoding is improved, so that the students are better able to access that high level text vocabulary, because obviously if they can't read, they're not going to be reading as often and they're not going to have a chance to read vocabulary. So I would say yes. And if you are in Language Therapy Advanced, I would go through Module 1 where I talk about, there's kind of this big matrix of, well, vocabulary improves one's ability to learn, to read and comprehend, but then also reading improves vocabulary. So it's kind of a chicken or the egg kind of thing. So really my comment here is similar to what I just said with the last question, is that yes, decoding is really important. Remember that phonology is a component of vocabulary. So if you are working on phonological awareness, and if you are tying in an orthographic and morphological component, you are working on vocabulary and decoding at the same time. There are a number of different things that can impact comprehension that's actually going to enable students to be able to learn that vocabulary. So again, that semantic knowledge, the lexical knowledge, and then their phonological and morphological abilities, which would impact their ability to decode quickly without that cognitive load, and then also syntax. So those are the things that have an impact on comprehension. So yes, you are going to be improving your students' ability to access vocabulary and learn vocabulary if you improve their decoding abilities. So what I would do in these cases like this would be to figure out, is this being addressed elsewhere? Is there another teacher who's working on this? Are they doing it adequately? Things like that. If they are, then you might want to try to hit it from a different angle. So for example, if they're working on phonological awareness, maybe you're working a little bit more on semantics and vocabulary, or maybe even working in some work on morphology. In kindergarten, obviously, the morphemes that you're going to be working on are going to be a lot more basic than you would with older students, but you can start working some kind of emphasis into their instruction, even though a lot of the typical instruction in kindergarten is more focused on phonological awareness. But we should be starting to work in some exposure to morphemes as well, because kids know those words. Kids do know words that are multimorphemic. They can't necessarily spell and read them yet, but we can start to provide that exposure. So I would say that yes, you can certainly work it in. You can certainly work through emphasizing phonological awareness. This is a case where you also want to figure out what that student needs. Are they a student who has a pretty good, if you do vocabulary assessments, do they come out, where do they come out in semantics? Do they come out way lower on things like phonological awareness? If that's the case, then maybe what you want to do is have the main emphasis of your therapy. Maybe you are working on phonological awareness and you're kind of pulling in some of that work on semantic features and vocabulary and describing and things like that. But maybe phonological awareness and emphasis on morphology is the main focus. But if you have a student who is really low in semantics and phonological awareness, then maybe what you're doing is the opposite, where the main focus of your session is focused on semantics and describing and putting words in sentences and things like that. And then you're just taking some opportunities as you're working on different words to emphasize those phonemes and talk about beginning sounds and talk about all the different sounds in the words and go with the letters and just kind of pull it in. So there are ways to do it where there's a main focus on one and you're pulling a little bit in on with the other one, and you're pulling something in just periodically, and vice versa. And honestly, if you're not really sure which one your student needs, you can toggle back and forth between the two of those things. I actually recommend kind of cycling through and having one focus for a while and kind of switching back and forth. So you certainly can. And then yes, absolutely, decoding absolutely will impact your students' ability to access that grade level vocabulary. So I would just problem solve with your team. Make sure that if a student is really one of those students who needs work on everything. So, some students where it's like they need work on decoding, they need work on vocabulary, they need work on syntax. Work with your team and figure out, are those needs being addressed somewhere? You don't need to be the one that's addressing all of those things. You just want to make sure that somebody is addressing it somewhere. And collectively as a team, you want to make sure that you're addressing all of those things. Unfortunately, if they're not really getting a lot of those those skills in other settings and you are kind of on your own with it, then that's where you want to do kind of cycle through the different skills, make one thing your focus and pull in the other thing, and then, switch the focus, and then, pull in, switch your main focus, and then have something else that maybe you worked on before as the main focus, just kind of pull it in to review and things like that, so that you can kind of cycle through and change the emphasis of your therapy. But you would hope these days that kindergarten curriculums and the students who are struggling in kindergarten would have access to good instruction on phonological awareness these days, but you just never know. So that's absolutely something where you could also train people or consult with people to take what you would want to do in therapy if you had the perfect world, and kind of spread your skills out and train other people to reinforce what you're doing in therapy. All right. So last question here, and I am actually going to go through this one really quickly because we have talked about it in depth, and I can actually just direct you to some other discussions about this particular question. But the question is, where can I find goals for Tier 2 vocabulary words? So short answer, if you are in Language Therapy Advanced, in your SPOT framework guide, I do talk through goals. However, you'll notice that a lot of those goals are like, I just have 6 basic goals that you're going to want to use as your starting point, and then you can customize those to make them more specific. And the reason that I do that is because that's how you want your thought process to be for goals. Kind of have your main areas that you know you're addressing, start with that script, and then just customize it for each student. Sometimes when we have these big goal banks, we can use it as a crutch. What you want to have is a good process for writing goals, because then you're not dependent on the goal banks. I used to use goal banks, but I got to the point where I didn't need them because the goal bank was in my head. When I had a good process for writing goals, I didn't need to go and look at a bank of things, because a lot of times if I did, then what I was working on in therapy was kind of contrived anyways. So you want to figure out how to work through that process. Now, the specific process for vocabulary is that, again, I focus on process and not what words they know, because vocabulary growth is not linear. There's not one set list that kids need to know. There's not one set, these are the words that kids need to know at each grade level kind of a thing. It just doesn't exist. I know that we want that. And there's not really, even though I do in the Vocabulary Foundation outline a way for you to measure how well your students are able to define and describe words in a way that helps you to structure your data collection, it's really hard to tell when people know a word, because word knowledge goes way beyond just basic identification and naming. Those are just 2 very surface level skills that can indicate some amount of vocabulary knowledge. So the problem with that is that we don't necessarily know if the student can necessarily use the word just because they can name and identify it. So that's why I do not recommend writing goals for Tier 2 vocabulary, like student will know, this word list, or even saying Tier 2 vocabulary. I don't even recommend saying Tier 2 vocabulary in the goal. Sometimes I might say age appropriate or grade level, because the thing is that with a kid with a language disorder, while you probably are going to be spending the majority of your time on Tier 2 vocabulary words, that's kind of a curricular thing. And you can't necessarily guarantee that those words are going to be appropriate for your student. They probably will be in a lot of different cases, but there are going to be cases where it might be appropriate for you to pull in some Tier 3 words, or where you might need to address some Tier 1 words with your students. So that's why I don't recommend going there with your goal. I recommend focusing rather on the process, because you're just not going to be able to get to a certain X number of words this year. And even if you could, it wouldn't be very functional and meaningful anyways, because vocabulary development is so highly dependent on context and exposure. And just because a student can, just because you can kind of check off the list that the student knows these words or can match these up with your definition, it doesn't actually mean that your student has learned a meaningful skill. So what we want to do is focus on a process that's going to help our students more aware of words and be able to notice those little features of words that are going to help them learn other words. It does make it feel a little bit messy, but that's actually what's in our students' best interest. So that's why I recommend starting with something like we'll define or describe words with 3 to 4 attributes, because that way you can work on a number of different things under that goal, like categorization, associations, and you can do it with different words, so that as you're cycling through different units, you can see if your student has the ability to apply that process and that skill to different words, because ultimately that's what you want them to do. You don't want them to say, like, I know these words. You want them to be able to come to a new word that they don't know and think about it and be able to explain it, because that's what's going to help them learn words. So we want to focus more on process, not just content. Even though content is important, obviously you want to be picking the right words. That's why I have a whole course on how to pick the right words. But we want to get away from just thinking that we've got to fit within this box. Unfortunately, like with the first question that I talked about today, there are administrators that might want you to do it a certain way. But I would really just explain to them how language development works. People who want you to fit language into this nice, neat little box for your data collection, they don't understand how language development works, especially in the school age years. It is a little bit easier with 0 to 6. You might, if you Google 0 to 6 language developmental milestones, it's a little bit, you can find more developmental milestones charts that say, by this age, these are the skills that a student should be doing, etc. Or at least gives you kind of a sequence of some of those skills. But really in the school age, it gets a lot messier because it's so dependent on environment, and there's not a nice little neat, like, by this age, they should know this thing like we all want. So we've got to get comfortable with it being a little bit messy, and finding a way to meet in the middle to make sure that we're legally compliant with those things, and that our goals reflect what we're doing in therapy, that we're doing the right things, but also not just putting ourselves in this tiny little box so that we're focusing on just very help our students. So with that all being said, those are all of the questions that we had in the group. If there are any other questions, feel free. I see a couple people on listening live, so feel free to ask any other questions. I can always answer questions live, and I'm happy to do that if people have additional questions. I know sometimes people kind of like to just hang out and listen to the other questions that have come up. All right, so I know I'll just wait a second here to see if anybody has any other questions, but if not, I will sign off in just a minute here. Just so you know, I will be scheduling another Q&A session probably for January. I know everybody's getting ready to be on Christmas break if they aren't already, but I do want to schedule another Q&A in another month when everybody gets back to school in January and gets back to work, and after the craziness of the holidays has stopped. So that's what the plan is. We'll be doing another Q&A in about a month. But if nobody has any other questions, I'll sign off today, and everybody have a great day.